time and over tell you that it's very important to take care of yourself. And one thing that is always a miss, भूल ही जाते हैं हम वो करना, is going to a dentist for a regular visit. How often do you do that? I only do that when there is pain somewhere in my mouth. That's when I run. But regular checkups are really, really rare. And that's why joining me in the studio right now is Dr. Rahi Rustham Sha Abdul Rahim, GP hai, dentist hai. You know, his specialty is dentistry. He practices in NMC Medical Centre, Shahba. He's here to talk to us about oral hygienes and habits. So welcome to the show, doctor.
Thank you so much, Mariel, for welcoming to the show.
So sweet. Dr. Okay, you've got to tell me something. Like I rightly said, I said we visit our doctors, our dentist especially, only when we have problems.
True. Yes.
So should that
No.
be the way we approach things, or it shouldn't be?
Actually, whether you have a problem or not, you should be always visiting a dentist every 6 months for any time, like whether it is a child or an adult or a person who cannot go to the dentist, who are having disabilities. For them also it is a very urgent need, because they will not be sometimes able to complain to you that we have some problems. So if you can get a dentist to have a checkup for them, that also should be done.
So at what age, doctor? So if a child is 2 years, 3 years, at that age as well, should we start prepping them, or is it after 10?
Yeah, for brushing to be started, it should be from the time when the teeth comes to the mouth. So for some kids, it can come from 6 months onwards. When the first teeth comes, you have to start brushing the teeth. You have to clean the teeth. There will be a lot of food sticking to the teeth. So all those things have to be taken care. You can just clean with the cloth or a plastic brush, a small brush which comes with, which we can put it in the finger. So, but it has to be started right moment from the eruption of the first teeth. Yes.
So is that where we get things all wrong?
Yes.
Okay, what happens when you become an adult, right? I mean, I know going to the dentist only when there is a problem, there is a cavity, or the wisdom tooth has to be taken off, or there is a root canal, and which is really painful. I've done like 3 of them already, and it's not a good procedure. So tell me, how do you kind of prevent things like that?
Yeah. So why we always ask you to come every 6 months is, most of the people, there can be a problem. There cannot be any pain for some patients. There will be only, for example, you come for a regular checkup and the dentist is saying that there is a decay which has reached the pulp. You will be like shocked. I till now I didn't have any pain, doctor. You will be saying. So that is when we realize that we have a lot of problems going on. So that is why checkup is most important.
So is food somewhere correlated to the health of our teeth?
Yeah. So for my all patients, what I always tell is, whatever goes in your mouth, water should be the last one, because whenever you eat any food, especially sugary foods, it will get stuck somewhere, or the places where there is lot of ridges in your teeth.
Correct.
Where corners and where your brush cannot reach. So you have to put water and gargle immediately. And when you reach home in the night, always you have to brush for it to be healthy.
All right, doctor, what are the common mistakes people make when brushing their teeth, and how can you correct them? Thank you so very much. This is coming in from Anand. Common mistakes made by people.
So there are people who brush right-handers will brush more on the left side and cause lot of sensitivity for the left side, and for left-handers they are very rare, but there can be issues when you brush only on one side continuously. Your power hand will be brushing the opposite side continuously, so that you have to be taken care. Also, when you are brushing, there are certain motions which the dentist, when you regularly visit, they will tell you which motion your brush should be and where it has to touch, like teeth and gums. Some people only do on the teeth, some people on the gums. So it has to be in that way.
All right, what about flossing? I've heard flossing is a new trend and you must do it because it keeps your teeth really, really healthy and it removes and it eliminates, the unnecessary dirt
Yeah.
collected.
So flossing actually is very old technique, but water flossing and all came recently. There are a lot of flossers which is available in the market. So flossing, especially when you eat any foods which are fibrous, there are a lot of food which will stuck inside your teeth, in between your teeth, which is not the brush will not reach in that areas. So that will be eliminated by flossing.
You know, doctor, I have seen so many people who maybe do not smoke, who maybe do not vape, but I know people who drink, who are heavy coffee drinkers and heavy chai drinkers, and they have these stains on their teeth, right?
Yes.
I mean, if you have to advise both a smoker and a non-smoker and someone who really loves having their coffees and their chais, and with that stain, with that yellow teeth, what would you tell them?
So, when you are drinking one whole cup of coffee or tea, you can finish it, and you go back and gargle immediately. Don't keep it in the mouth. When you keep it in the mouth, it what happens is it will form a band, a small band. It will start forming, and it will cause stickiness in your teeth. Then there will be a lot of debris, dead cells which can accumulate. This is causing the main issue for people to take care of. They don't know where to clean that area. So whenever you drink tea or coffee, immediately put water with your finger, just clean your teeth and gargle.
Wow. Now, I didn't know the process was so huge, especially once you have a cup of tea or coffee. But I've also heard a lot of people. So, I do not like a firm brush, right? I don't like these hard bristles on the brush. I like something a little more medium, not soft, maybe medium. But I've been told harder the bristles, better the. The cleanse around the mouth. Is it true?
No, actually, it is the opposite. You can use soft or ultra soft, never the medium or the hard, because medium and hard also does the same job as soft or ultra soft. What happens is when you bristle with hard brush, the friction which causes is more than the soft or ultra soft brushes. So you have to always switch to soft or ultra soft. You will not feel it first 2-3 weeks. You will feel like you're not even touching the teeth.
Correct. And that's what I've been told. If you can't feel anything, how do you know it's getting cleaned inside?
It will get cleaned the same way as the other toothbrushes. But best way is to switch to soft or ultra soft.
Very interesting. I did not know about this, right? When it comes to now brushes, now you have to admit we've become super lazy.
Yes.
Yes. So which means comes an invention and it says, listen, if you can't do it, we'll do it for you. Electric toothbrushes.
Yes.
What's your viewpoint on it?
Yeah, I tell whoever can do manual, it's best to do with the manual. But if you know the proper techniques, then electric toothbrushes is okay. But for kids, first teach them with manual, because they don't know how to do the brushing properly. Initially, at least I would say from 5 to 7 years of age, you have to monitor them at least till that time, because here the way of taking care of oral hygiene for the kids is like, because the parents will be very busy, they will not have any time, so it is neglected many times. Whenever we see a patient, most of the time when we ask them, they are saying they don't even brush, some people.
Yeah, because I'll tell you why. What happens, I mean, with kids, right? And especially when they're little, you've got to put that finger brush into your hand, onto your finger, and you've got to put it into their mouth. And once they have teeth, it means there are high chances that they will bite onto your finger.
Yes.
And it does happen, right?
Yes.
And children can be very stubborn. So how do you teach children, doctor, the habit of brushing, right? Children don't like brushing.
True.
So how do you teach them?
From initially, it's very difficult, like you said, but once you start that habit, slowly they will start developing that what you call it, technique by themselves. They will understand that, okay, this is the way how it has to be done. But you have to be there. You cannot say that now you do it like how I have showed you. No, their brains have not properly developed till the age of 2 or 3. Their brains have not properly developed till the age of 2 or 3. They will only understand what you are doing, but they don't know what it is.
Very interesting. Wow. Now, if you have a question as well to ask, send them in on 05 8686 seated right before Dr. Rahi Rustham Sha Abdul Rahim. He is a GP dentist and he's here to answer your questions. So, if you have any questions around your oral hygiene or a pain that is, that has really not subsided, ask those questions right now. You'll never know when next we get a chance to sit besides doctor and get our questions answered. So now is the time. Immediately send them in on 05 8686
This is Live Talk with Muriel Desar. Talk 100.3.
11:21, a very, very good morning to you. My name is Muriel, keeping you company all the way until 3 o'clock. Alongside me is Dr. Rahi Rustham Sha Abdul Rahim. He's a GB dentist and, he practices at NMC Medical Centre in Shahba. Now, doctor, really important questions that we are answering here. According to you, you did mention about this, that brushing is important and so is flossing. But which one would you give more priority to?
Both we have to give equal priority. Why? Because whatever contents which is coming out from the brushing is not the same as flossing. Flossing cleans in between the teeth where it is getting neglected left and right from the patients. Mainly from most of the people, the decay happens silently from the side than from the places where the teeth is touching with the brush. So flossing is equally important.
Now, doctor, yes, we know that brushing and flossing is super important. What's one simple habit that people can adopt to significantly improve their oral health?
Main significant I would say is get used to flossing and gargle after every meal. That is the main thing which you have to do, so that you don't forget that oral hygiene is there. You keep it as a habit. You will not even realize that you are taking care of your oral hygiene.
Right. And doctor, one problem that usually we come across is individuals have really bad breath, right? And does that stem from what they've eaten, or does that stem from the amount of germs, or how unhygiene their mouth is?
Okay, so oral bad breath is a main issue for many people to lose confidence. So why it happens is of n number of conditions. Actually, there can be because of oral hygiene conditions. There can be because of gut health also. Whatever we eat and whatever issue they have in gut as well as this problem. So what I would say is start cleaning your tongue. Tongue has main problem than the teeth for a oral bad breath.
Doctor, there are so many toothpaste available in the market, right?
Yes.
So many. Some say we give you ultra white teeth. Some say diamond like white teeth.
Yes.
And the others are on another path altogether. So which one should we as individuals or lay people who don't understand which toothpaste suits us, which one should we go after?
So what I would say is whichever you are using right now, if it is comfortable for you, use the same paste. Don't switch a number of paste because you see advertisements, and your dentist will know better which toothpaste will go for you. And always a normal toothpaste should be used for a daily use. If you have a condition like sensitivity or any other conditions, if your dentist prescribe you one toothpaste, you use that till you finish that paste. Then you ask your dentist again whether I should continue it or not. Don't continuously use one toothpaste, because there can be some medicated toothpaste and gels which has to be discontinued also. So dentist will always tell you when they prescribe it, but we often forget it. So again you have to go back to the follow-up visit and make sure that it has to be continued, or you can use it continuously.
Doctor, you've also got to tell me now, with the amount of issues that we are going through in our day-to-day lives, right? I mean, we have a lot of lifestyle-related problems. Are there particular brands for that as well? Like, for example, say if someone is a diabetic, should he be avoiding certain toothpaste or certain makes just to ensure that he's not kind of consuming that sugary content?
That way, sugar sugar free, most of the time it will be sugar free. Sugarless, it is mainly for the kids. Like there is paste which contains xylitol and also fluoride free. That is the main concern for the toothpaste. So because kids need fluoride, but when it is in the toothpaste, it kids, they don't understand what it is. They will simply swallow it. So the ingestion will be more fluoride than what it should be for the kids. That's why we advise them for fluoride application every year or every 6 months when they come for a checkup. If it is required, if they have any small decays, we will fill that up, and then we will do a fluoride varnish or fluoride application for their teeth.
With the amount of junk that we consume on a day-to-day basis, and I'm sure so many of us do it, it's impossible to have a spotless tooth or a teeth, like a set of teeth, right? And still I've been told that it's not just the food that you consume that affects the teeth. Your teeth actually kind of voice exactly what's happening to your system. So looking at your mouth, a doctor is in capacity to tell you what your health condition is. Is it true?
Yeah, there are many recent studies have coming that they are even associated with Alzheimer's disease. So what I'm saying is, when a teeth have problem, or if you come for a regular checkup, we can even tell you which side you are eating more and which side you are not eating, because sometimes they'll be same like iron rust, and you set aside an iron and it rusts up. Same like that, when you don't use one side of your teeth because you have some problem on that area, and you use the other side, there will be a lot of deposits building up. So we can tell you what problem you have, which side you are eating, and in case if there is any issues, like for example, some people will ask, doctor, I have cleaned a few months back and still I have got again deposits coming back. So whenever that patient comes, sometimes I will ask any like there is kidney stones or something for the patient's relatives or father or mother. Sometimes that is also associated because they have that build up happening. That can be that extra deposits.
Right.
It can cause in the mouth as well.
Okay, we have a question saying gums turning black. Is that normal?
In what way it is turning normal? So, like for example, some people's black gums will be more of a melanin content, and if he is a smoker and turning black is because of the smoking issue.
Is that a concern that the person needs to...
Aesthetically, definitely yes. Also, smoking is a bad habit. You
I
have to.
I 110%
Yes, it is,
agree.
yeah.
But should I immediately be going to the doctor to show my teeth to the doctor then?
Yeah, if it is becoming more rigorous and you are not able to, like, you are not confident, or
Bleeding of the gums
bleeding
as well?
of the gums happens regularly if you don't take care of it. If you smoke, if you are a regular smoker, definitely there will be mild bleeding always, but you have to. That's why we always urge, whenever you come for a cleaning, stop smoking. We say 100 times because of that one, because gums are the first one to affect, and then it starts going down to the bones and everything.
Very interesting conversation with Doctor over here. We're going to continue this in just a bit from now. Coming up next is something that you absolutely love, and it is traffic.
The smooth music and live talk with Muriel Desar. This is Talk 100.3. Live Talk 100.3.
11:39. A very good morning to you. My name is Muriel, keeping you company all the way until 3 o'clock. Seated right before Dr. Rahi Rustham Sha Abdul Rahim, GP hair dentistry. That's his specialty, and he practices in NMC Medical Centre, Shahba. Now it's really very easy. What you can do, you can download the NMC My Health app, and that takes complete control of your healthcare. Book your appointments for yourself and your family. Find the right doctor, manage bookings, and view lab results all from your phone. Get the NMC My Health app today, free on the App Store and Google Play. Booking appointments has never been easier, and I've said now, if you have any questions regarding oral health or regarding the brand of toothpaste to use, should you be using, should you not be using, or any other questions, send them in right now on 0586861003. Doctor, we got a message from Rajesh and he says, hello Muriel, question to doctor. It's a long query. What is the opinion on use of Vico, Vajradanti or Miswak? There are a lot of evidence that traditional toothpaste does cause harm in the long term, and it's recommended to take natural options as well. So even the toothbrush has issue due to the effects of microplastics, and it is suggested to use alternatives like bamboo toothbrush instead. What do you have to say?
So, hi Rajesh, this is a very good question. There are many aspects for this because it's a very long query. So, I would start with paste. So, in the paste itself, I told whichever is comfortable for your teeth, you use that one. In case if any problem is there, you visit a dentist every 3 or 6 months. That time they will advise you which has to be done and which has to be discontinued. So yes, natural has little bit of coarse materials in that one. So initially you will feel good using that, but you have to always read the labels, because it is written as natural always doesn't mean that it is natural. So same with the normal ones also, like traditional ones which we are using. And in regards to the bamboo toothbrush or the microplastic normal toothbrushes, there are people who use miswak as tree roots. So instead of using bamboos, there are many people opting for miswaks, because miswak you can cut it off and clean it again and again, but bamboos you have to again discard every 3 months. Otherwise you are causing same damage as the plastics, because even plastic, that is the reason we always say every 3 months you have to change the brush. Once you see a visible or very slight changes in the brush, you have to discard it, because the health of that toothbrushes stays that much only. Like same like our mobile charger, we say a specific time cycle. Brush has only 3 to 6 months. Best is to discard in 3 months itself. 6 months, not necessary that you have to go till there, but 3 months is the best option. After that, it can cause problems for your teeth.
Wow, that's some great information, doctor. Now tell me something about this term that is doing the rounds and it is so famous. We're talking about charcoal white cleaning teeth, right? I don't really understand. Does it really make your teeth white? Or is it a marketing technique?
Yeah, definitely. Because charcoal as such, if you take and use, there is no visible changes. Charcoal in the toothpaste has no meaning to it. It is mainly done for marketing, because beauty and confidence is one of the main things to be targeted for brands. So what you have to keep in mind is always use the normal toothpaste, and whatever comes in the other form, like for example this beauty products, you have to always be cautious, because charcoal pastes and all contain some particles which are not healthy in the long run. Maybe in the initial 1 or 2 times, because it is having aggressive coarse materials, you will feel some white color or extra. So you will think that, oh, this is good. You continuously start using, you will get more stains and more yellowish tooth color. Same goes for whitening also. That I will come back in the...
Please explain, doctor, what is whitening? And I know a lot of dentists recommend whitening of the teeth. Do you recommend that as well?
Whitening I recommend only occasionally, like not for left and right you come and we do. No, if naturally an adult tooth is slightly yellowish in color, it's not pure white. That is why we call a baby tooth a milk teeth, because it resembles milk color. Pure white color. For an adult tooth, it is always slightly yellowish. So you don't need to lose confidence seeing other people's white color, because mostly sometimes they'll be wearing veneers or crowns, so that they can change the shade. But our natural teeth, we can never change the shade. You do a whitening, it will stay only for 3 to 6 months. After that, always on doing it. But when you do it like that every 6 months, it will damage your teeth. You can do it like, for example, you're going for a interview and you want to feel confident because you are sure you will land that job. So in that case, or a wedding is coming, or somewhere you are going where a large group is there, you can do it, but not continuously. And you drinking tea, coffee, if you are a heavy smoker, a heavy coffee drinker, within 2-3 months it will come back to normal, and you cannot blame the dentist saying that you have done a whitening and it has come back to normal. It is normal if you are a coffee or a heavy smoker.
Now, there are certain kind of aligners that are clear in color and they are, and people are opting for it rather than having those braces in your mouths, right?
Yes.
Why is that trend taking place? Is it less, less harmful to your dentures, or is it a little bit more easier to maneuver?
Same like I told, it's all about the concept of beauty. Because the normal braces has that metallic smile, and many people don't need that smile when they go outside. They don't want people to see that they are taking a braces. So for them, or best option now is either conventional or this invisible aligners. Both are okay. Both are, if you are going to an orthodontist and getting a treatment done, they will suggest you which one to go for it. Both in terms of treatment, there is no difference. And metallic braces also does a good job, same like an Invisalign. Invisalign is one of the brands, but it is also a clear aligner. So more convenience. You don't need to run to the dentist every time you break one bracket.
Or if there's pain somewhere. Is it very painful, the metallic ones, the metallic braces in your mouth?
No, it is not painful, but initially when you put it and you feel the tightness, there will be some kind of pain which happens due to the tooth movement. So yeah.
Right. Doctors keep advising you time and over again to be very mindful of the children at the younger age as well. And I'm sure you advise this to your patients. Yeah. So when it comes to the young kids, and especially once they have their milk teeth fallen, right? It's time for the permanent ones to come out. How do I, as a parent, ensure that the teeth are not crooked, and so that in future I, avoid the risk of putting in braces or anything of that sort?
Yeah. So when during the regular checkup itself, the doctor will tell you according to the age whether a tooth has to be removed or it has to be kept. For example, a 7-year-old will have molar teeth on the back of the mouth which is decayed and needs a root canal. So even for kids, we can do a root canal. Even to the age of 2 or 3, there can be root canals done.
2-year-old going through root canal?
Yeah, that is to save the tooth, which is done, which has decays mostly. So to prevent the space, because natural teeth is the best space maintainer. If you are pulling out a teeth before the age reaches, you have to put something called as space maintainers. That one will not be a good thing for a kid. They will not like it. Some are removable. Mostly we don't prefer that. We prefer always the fixed ones. But that is unnecessary change. If you can save that tooth by doing a root canal and putting a small steel crown, it is functional also. They can chew the food, because most of the time babies don't say they have pain. They will keep crying and they don't take a food. So that is because they have some issue going on in their teeth. And if you pull that out before the age, slowly the teeth will start moving or shifting. That is when the crowding starts. That way a permanent will erupt in different locations. And sometimes some people, even after the teeth starts moving, they will not remove the teeth. They will tell, it will fall on its own. Don't do that also, because the permanent teeth will be already down waiting to erupt, and because this is staying there in the tissue, it will not fall out. So
that's how the process
the crooked
works.
teeth happens.
Wow, we got a message from 792, and this person, please write your name. You're saying, Doctor, I have 2 questions. One, where should I remove my wisdom tooth? And also, I have a daughter who's 7 years of age, but the milk teeth haven't fallen. We're all worried. All her friends, all their teeth have fallen. What do I do?
Yeah, that's what I said. First of all, for the wisdom tooth, only if it is troubling her, or causing any issues, then yes, it is best to get it removed. No need to keep it there. If it can be saved by doing a root canal, because always all the wisdom tooth is not crooked or sleeping position. It can be also erupted naturally in the oral cavity. So if it is properly erupted, or if it is not troubling her, or first time if they are troubling, the dentist will see, they will give antibiotic medication, they will tell you don't need to remove it now, maybe it will erupt. If it is not in that condition, if it is decayed, get it removed. For the 7-year-old, yes, you have to have a checkup with the dentist. They will take an X-ray and see where the permanent tooth is and where their primary, the milk tooth, is staying. Sometimes
I think all the teeth, that's what he's written, all the teeth haven't fallen, but her friends, all their teeth have fallen. What is the appropriate age?
That's what. For front upper teeth, it is 7 to 8 years. So there are still time. It might be coming to erupt. The permanent teeth, when it comes slowly down, it will start resorbing the primary teeth. So, or if it is coming ahead of the primary teeth or below the primary teeth and it is not touching the roots, that is when the roots will not resorb or it will not start moving. So for all that things, you have to take an X-ray and see what is the condition going on inside the teeth. It's inside the gums. Then only we can say for sure we have to pull it out.
So what if one of the milk teeth fall off because, the child has bumped their tooth and at the age of 3 or 4 and it is broken?
Yeah.
Is that okay? Will he then still get his permanent teeth in that area or?
Yes, definitely. So for kids, we don't usually put it back like how adult teeth is, because their permanent teeth will still erupt. In case if it is still inside the gums, we can just keep it there. Or if it has gone, like for example, if they fall on their face and the tooth is pushed little inside, it will naturally erupt within few days. Or if it is a concern, you have to go to the dentist and get a checkup done, because sometimes they can swallow the teeth, sometimes it can be gone to the soft tissues.
Right.
All those things can happen. So always when you get a fall injury, you visit the dentist.
Right, doctor. Now I have a few more questions, like how many times in a day should I use a tongue scraper and a mouthwash?
Yeah, tongue scraper along with your morning and night routine, best, because I told you bad breath mainly happens from the tongue, not from the teeth. Not because you have not brushed, you will not get a bad breath. It is mostly from the gums and the tongue. So tongue cleaning is must. And mouthwash, I don't recommend my patients mouthwash always. Only if there is any severe bleeding or extractions done, I will prescribe only for 1 or 2 weeks. Otherwise, I always tell them to do salt water gargling, because that is the best mouthwash we have, which we don't use it. It is free also. It doesn't cost a huge sum, for mouthwash.
But we will go and spend 100 dirhams to buy a mouthwash.
And many people in UAE, if you don't believe, they use only mouthwash. They don't brush.
Ew, why? I'm sorry for that reaction, but why?
Yeah, that is because they think that will help the tooth hygiene more than brushing. Whenever I ask patient whether you brushed or you did only mouthwash, they will say mouthwash only.
I'm so intrigued in knowing. Do you sit with a stick when people say things like that?
I wish to, but here, we cannot.
All right, with
Proper
festivals.
education only we can do.
But this is so strange. And you're talking about people who are learned, right? Who are well educated, saying we don't brush our teeth, we don't floss, but we just
Maybe they are
gargle.
busy,
How busy for a 5-minute job?
Yes.
All right, doctor, with festivals round the corner, we know sugary drinks, which means your sodas, which means your mithai, which means your dessert, your dates are going to be galore in front of you.
True, yes.
Okay, you can't resist them, but how
Yes.
can you protect your teeth?
Yeah. So this is why I always tell my patients, you cannot resist even a kid asking for a chocolate. Whenever they come and I say there is a decay, they will be like, see, I told you not to eat. You can never tell a kid not to stop eating chocolates. Always educate them. Whenever you eat anything, whatever goes, like bread, biscuit, whatever you eat, immediately you have to put water and gargle. And especially for sweets, whenever you are fasting or whenever you are having your mouth dried, there won't be any salivation much. So you have to always remember that you have to keep your mouth moist. Spit whenever possible with gargle. only plain water. Mouthwash, when I am referring, I always mainly think of plain water. Gargle regularly, and whenever you eat sweets, you make sure that nothing is stuck on your teeth after that. You brush if possible, because some biscuits and chocolates, it will get stuck on your teeth. So when it gets stuck, there will be acid production by the bacteria, which weakens the teeth, in turns decay, and then the process will go on.
All right, doctor, I have another question for you, and I feel this is a common thing that I see everybody. In fact, you go for a meeting post lunch.
Yes.
And okay, now just imagine this. You're going for a meeting post lunch. Even as a doctor, you're going to be seeing a round table conference with other doctors, all with chewing gum in their mouth.
Yes.
Right?
Yeah.
Why do people have a chewing gum immediately after food? Is it, a myth, or is it a reality that a chewing gum can actually cleanse your mouth?
Yeah. So what the chewing gum is doing is, always whenever you're eating a chewing gum, if you are going to be habituated with that, prefer xylitol based, not sugar based. Xylitol is with sugar, but it is not sucrose or fructose based sugar. So what happens is, whenever you chew a chewing gum, there will be a lot of salivation in your mouth. It will cleanse your teeth or keep buffering. It is having a acidic basic medium. The saliva always helps your teeth clean. So whenever there is more saliva in your mouth, there is less chance of getting a decay. That's why people prefer doing eating chewing gums after meals.
But there's nothing wrong with it. You won't damage your teeth or anything of that sort, right?
No, but there is one more issue with that one. You should not continuously grind, because when you chew, you are grinding, right? So that can also cause grinding, and grinding of the teeth can cause little bit sensitivity if you continuously keep doing it as a habit. You should not do it regularly, like, when you finish one chewing gum, you take another one. No, you can do it minimally, like maybe for till you finish that taste, you can throw it. Not like 1 hour, 2 hours, you cannot.
Yeah, people constantly move it from left to right, and they even there are times that it's quite disgusting to even mention it, but I've seen people do that. Nonetheless, doctor, thank you for this session. It's been quite an eye-opener. A lot of things that I learned as well, so thank you very much. Looking forward to yet another conversation with you.
Thank you for inviting me to the show. It was a very lovely session. Thank you so much.
You're more than welcome. We're going to continue the conversation over here. Coming up next is traffic, so stay tuned.